Hello everyone, my name is Shahir Gomez and my project is going to be on Pneumocystis Pneumonia. Just to make it easier on you and me, I'll just go ahead and call it PCP for the remainder of this presentation. So what is PCP? PCP is an infection of a yeast-like fungal infection in the lungs, and it actually targets people with a weakened immune system. To be exact, people with a healthy immune system don't normally contract PCP, or if they do, they can carry it, but don't show symptoms. It's just basically in their system, but they don't show symptoms. So PCP can actually spread from person to person through the air. And like I said, people who don't show symptoms can spread it to other people. So it's actually much like coronavirus now, which some people can contract it and pass it on to others without knowing it or without wanting to, unfortunately. So the history of PCP. It was actually discovered in animals originally by a scientist in Brazil in the early 19th century. So it wasn't actually until 30 years later that it was seen as a human pathogen, which leads me to a controversy that is seen with PCP, whether it should be called Pneumocystis carinii or Pneumocystis jirovecii. So what are the differences? So when it was originally discovered, it was called Pneumocystis carinii. So this is actually the pathogen geared towards animals rather than humans. The humans is pathogen is seen as Pneumocystis jirovecii. So because of this, you can actually see it being used interchangeably in publications and medical journals and stuff like that. So because of this, many people feel like it should be completely separated from animal pathogen and human pathogen. So approximately 20% of adults can carry PCP at any given time. That's just people that don't show symptoms, that are just carrying it. 40% of people are people with HIV that contract PCP, and people with HIV are the people that show those dramatic symptoms and can actually harm them the most. This is because PCP is actually the leading cause of deaths in people with HIV. So it's actually pretty hard for them to recover from this type of infection. And then the other 60% of people that contract PCP are usually taking medications that lower their immune system, so it lowers their ability to fight off infections, germs, sicknesses, and stuff like that. So the diagnosis actually takes a couple different tests, needs a couple different tests in order to diagnose exactly PCP. So first, an x-ray is needed of the lungs, of course, and a sputum sample is needed to be collected, and needs to be collected actually in a specific procedure called bronchoalveolar lavage. This is to differentiate PCP from any other cause of pneumonia. So when it's collected, it doesn't want to, obviously the medical professional doesn't want to just see your basic pneumonia. We want to differentiate PCP by itself. And then the last thing to confirm a person has PCP, a test to amplify the amounts of trace DNA polymerase in this case is used, and a blood test to detect beta-D-glucan is used as well. And lastly, treatment. So treatment for most people that contract it, your average person with is just your typical antibiotics. For example, Bactrim, which is an antibiotic that's used for a wide variety of different infections. And then other medications that can be used are Atrovagan and Dapsone, and these medications are actually targeted toward people with HIV and AIDS. So because their immune system disorder, they do need a special type of medication. And in the worst cases, so people that are in the later stages of PCP, they might need oxygen therapy, so to get that oxygen back in the lungs and in the bloodstream to help that person out. All right, thank you very much.